Hi, this is Ed again, and I wanted to address the issue of lower back pains. I've had experience with lower back pains personally, and also I've worked as a registered nurse for almost 20 years. But most of the info that has been helpful for me has not been by the book, so to speak. It's been more homeopathic or natural. Um, and I want to address this because I was in very bad shape at about the age of, it was about 30, 35 around there when it started. Lower back pain on the right side, leading to my lower left leg. I had sciatica and I had to get workman's comp. I got one check. I was in really bad shape from working as a nurse. I think I lifted a very heavy patient off the floor, not using the proper body mechanics, and not at that moment, but the next day I started feeling pain in my leg, which did not go away. It got worse and worse. I didn't know what it was. I started taking Tylenol, aspirin, Motrin, all this stuff, to the point where I went to a doctor, and that's when they told me it was my back that was the problem. That was hard for me to believe because I didn't have pain in my back. I had pain in my left leg. It started in my left thigh area, like on my thigh, and then slowly but surely, as I started doing the stretching exercises, then I'll post some here that I recommend. The pain did go to my back. I started feeling sharp pinching pain right in my lower back, right where the hip meets the leg there, and it was intense. I mean, I was literally crippled. I was freaking out. I couldn't walk. I could not walk more than a half a block. My entire left leg would freeze, and wherever I was, I just had to sit down and wait about 20 minutes before I could walk a little more. And it was very bad. I started going to doctors. I was using my credit cards. I had very good credit at that time. I had like something like 30,000 in unsecured credit, based on my good credit that I had, not that I have now, but I did have. So I started paying these specialists, and also through the workman's comp. I got therapy, physical therapy. I got the the cortisone shots where they take a long needle, they stick it in your back, basically in your lower back. It's like 5 shots or 6 shots of cortisone, which would help for about a week or two, and then the pain would come back. I mean, nothing would keep me from having intense pain if I walked more than like 10 minutes. It was horrible. So, well, this video is that I believe those problems can be made much better by natural methods. Even though I did receive all the medical stuff, the shots, I was going through physical therapy. I was getting opioids, which led to an addiction on opiates. I mean, I was getting Vicodin, then Percocet, and you name it. I've had it all, tried it all, and the pain pills, especially the 10 milligram Percocets. I mean that I couldn't even take the whole thing. I would literally get sick, nauseous. So I would take 3/4 of that, and it would basically kill the pain. And that's how I tried to work. I was literally walking on crutches. I was taking my crutches to work, to walk from the parking lot to the hospital, which was usually more than like a 10-minute walk or more. And I knew I couldn't do it, so I took my crutches. I did the walk, and then I would hide the crutches somewhere so I could work because I was embarrassing and I didn't know if they would tell me not to come to work with crutches. And that's how I was doing. And I was taking these pills to the point where I was turning green with nausea. Eventually, it led to an addiction. But through the stretching exercise, I will have to say, because I was even to the point of having surgery, and I don't recommend that. What has helped a lot to the point where I could function was and be pain free basically. Even though I'm still dealing with this issue now, it's been an ongoing issue. Is I recommend exercises, stretching exercises, any kind of exercise that will stretch the lower back. They taught me to do like a push up, but keeping my waist on the floor, my legs and waist on the floor, and lifting up to where it stretches your lower back. And I was doing those religiously. And the doctor explained to me, because I got to be friends with one of the specialists, and when I ran out of money on the credit card, he basically sat me down and told me, look, the real way to fix this thing is, and he showed me the exercises, and he looked at my MRI. I have MRIs, I have CAT scans. The MRI showed like I don't know how many slip discs, herniated disc in the lower back, mid back, and upper back, but the lower back has been my main problem. And he said when you do these exercises religiously, the area that's affected will basically scar over, and it'll be as good or better than before. So that did help a lot, a lot. And then I used cold packs. If the pain is severe, I use the cold packs. The stretching, the traction is very, very important, especially in the acute phase. The acute phase usually lasts about up to 2 or 3 weeks, and you might think that the world is over for you, that you'll never be good again. And that's where they get you with all these procedures of surgical procedures and heavy duty medications. But you really don't have to go there, in my opinion. If you, and I'm not a doctor, by the way, and this is just my opinion from my own experience, and also working with patients. I would try to help them in this way by basically when they're lying in bed, taking their ankles and just pulling them, holding on to the back somehow and pulling. That will cause a traction and cause to release the uh, the the disc. When it's herniated, it sort of comes out. But when you apply traction to the area, it will allow the natural healing and for that bulging to go back in. And I did all kinds of traction. I even hung myself upside down from a tree once with a rope. I jimmy rigged something where I could hang myself from a tree, and that's pretty intense. I don't really recommend that one. But what did help me a lot is I went to Home Depot and I built this traction device, because if you get traction, it's like $300 for half an hour treatment at the physical therapist. But what I did is I made a board, and then I screwed two boots to the top of the board that would fit me, that could lace on, and then I would put that board at a 30-degree incline, like laid on top of a bed, and then you lie down, with your head down, just stay there for half an hour or an hour and read. You can read or whatever. And that is really important in the acute phase, for the pain will be released almost instantly, and it will really help with the healing so that you can heal faster. And massaging the area helps a lot if you can get someone to massage the area. Or I have a massager here that I use when the pain hurts a lot. When it hurts a lot, I use this thing here. You can see it. It This thing turns on and it vibrates. I'll put it on right now because it's kind of hurting. It's always hurting. I got used to it. Ah, and that's like immediate relief. And so I recommend traction, cold, cold pads, stretching exercises, very important. Stretching exercises, you can make up your own, whatever you feel comfortable with, and do it 10 times, 20 times a day. As long as it's hurting, you keep doing it, and that thing will start to feel a lot better. And you're going to get a lot stronger. So I've met a lot of people with lower back pain, including myself, that are really suffering with this. They lose their jobs, they give up on life sometimes. I've known people that have surgery, and then the pain comes back even with the surgery. Sometimes, a lot of times, they say surgery is successful in like 50% of the time. I would not risk that, especially messing around with the lower back and your spinal cord is near there. I wouldn't mess with that with surgery, in my opinion. Um, but there's people that may need it. I'm not gonna knock those people if they need it, but most people I think don't need it. Most people can use like the stretching exercises, the cold packs, the traction. Your back will start to heal. I mean, the acute stage will last from 2 to 3 weeks, and you're gonna think the world is over. You will get depressed. It was horrible. I was dragging myself on the floor because I couldn't stand up, crying, crying. I was going into chiropractors' offices, crying. They did not help. They did not help me, the chiropractors. The only thing that helps about the chiropractor is that they have these devices and they use traction and they use massaging, and those things help a lot. But you can do that on your own. You don't have to pay a lot of money. You can heal your back for the most part for free. In some cases, like mine, they're very, very severe. I mean, it keeps coming back, but when I have to do something, with God's help, I'm able to do it. And prayer also is very important. The laying on of hands and healing of prayer, that helps a lot. And it's in the Bible. I believe the Bible is a true book. And so prayer is crucial. I mean, that's the first thing you should do is go to God and ask God for help and go for prayer. Have somebody lay their hands on you, pray for you. Go to a church, an evangelical church, they'll pray for you. Most of them will pray for you, especially the full gospel evangelical churches. They'll pray for you. If anything, if you don't like church, fine, but go for the prayer at least. Then you can leave, but go for the prayer. If you like it, stay. I've met a lot of great people in church. So that's my recommendation for lower back pain. Don't give up hope. There is a lot of hope. Um, if you see the result of my MRI, I mean, you will be surprised that I'm even able to walk, and I have my crutches there if I need them. But the exercises, the stretching exercises, you should be doing those daily. Eat good, healthy food. Don't eat a lot. If you eat a lot and you're heavyweight, I mean, forget it. It's gonna be worse. It's just gonna be worse. Not just the extra weight that your back is carrying, but it's just bad in a lot of ways to overeat. It's one of the worst things that I've seen as a nurse. The worst two things are overeating and lack of exercise. And I would put lack of exercise, lack of mobility on the top. That's the worst thing. If you want to hurt somebody and kill them physically, put them on a bed and tell them not to get up for a few weeks. And they will deteriorate. I have seen it. I have had patients that are fresh out of open heart surgery, not fresh because one day after that they have to be stabilized, but I've taken care of patients. I was a critical care nurse, ICU nurse, for 10 years, and neuro ICU, and even a trauma ICU I worked on. So I've seen it all you think of. And I found that if I get these people out of bed into the chair, even if they can't walk, get them in the chair, but get them out of the bed. they will recover. They will get better. I mean, the God has given us a body that heals itself, but we need to, if we work with this process, help this process by eating right, not overeating, and exercising daily. I mean, anything, any kind of, even walking. If you can walk 20 steps, then do that. But do it every day. Do it as much as you can. So those two things are very bad: overeating and lack of mobility, lack of exercise. Let me turn this thing off. And for the back, lower back, the simple stretching exercises, yoga is very good. Any kind of stretching exercise, I cannot emphasize that enough. I mean, eventually, your body will scar over, just like if you have a cut on the hand, which I've had a lot of. Sometimes, I used to work with, I used to have my own landscaping business a long time ago, little business that I had, and a cut will heal in about, I don't know, about a week. It starts to scar over, maybe 2 weeks, a week or two. But the same happens on the inside. We heal and we scar in the inside, and that scar tissue provides strength. If you have a scar, that part of your body is more tough. It's tougher than the other part of the body. It becomes tougher. Our bodies, they acclimate uh, to whatever we expose our bodies to. So stretching exercises, um, cold packs, traction devices, massage, and if you need pain pills, take them. Because if you don't take a pain pill, you won't move. If you're in severe pain, you do not want to move, and that will harm you also. But there's a catch here. When you're in the acute phase, you need to rest. This is very important. You do need to rest. You need to be lying down, but always get up and sit down once in a while. Never try never to be more than 2 or 3 days in bed without doing anything. You need to get out of bed, take a little walk, or sit down for a while. Then, if you have to get back in bed. In the acute phase, you need to rest. You need to rest so that, and that will pass. If you will allow the proper time of rest and the cold packs and the traction, you can do this while resting. Then once that passes, you start with the exercising. As soon as the body will tell you, as soon as you feel less pain and you can do something, do it. Your body is telling you it's time to do some kind of stretching exercises. If you are in so much pain that you cannot move, then don't. Don't move. Your body is telling you, don't move. Lie down. If you have to for a whole day or two, just lie flat on your back. You can use the cold packs and the traction and the massager. If you have somebody to massage you, even better. So that is very important. And if anybody has any other questions on medical, I'll be happy to answer them. My advice is more than medical medicine, by the book medicine, which use a lot of medications and mostly medications and surgery. And I don't want to say anything negative because I don't want to get myself in trouble, but I think you catch my drift here. But definitely natural medicine, herbal teas, massaging, cold packs, traction, stretching, yoga exercises, and what helped me a lot to boost my immune system, which I didn't do this for a while, but I did do it back then, is fresh vegetable juices, fresh juiced juices, especially raw carrots, raw organic carrot juice. I've even heard it heals cancer. I mean, it is this guy on, it's called the Hallelujah Diet. And this guy, he's like 90. He looks like he's 40. And the guy had cancer, terminal cancer, bone cancer, while he was in his 40s or 50s, I think. And they told him he had like 8 months to live. He went out somewhere in the country, in North Carolina, I think, and he just started eating raw carrots and raw carrot juice. That's all he ate, nothing more. Carrot. I don't even think he drank water. It was just carrot juice. No snacks, no nothing. Just carrot, pure, raw, organic carrots. They have to be organic. If it's not organic, it'll taste bitter. The organic will taste sweet, and it's good for you. That will boost your immune system and heal almost anything, even your back will help a lot. So I highly recommend that those things. If you have low back problems, I've been there. I'm there. But I'm at a point where I feel that I could help people because I'm at a point where you know, I feel much better even though I still need to constantly do these things. Um, so I mean, I'm not totally healed. I have to say, I'm still struggle with this thing, but I've seen what works and what doesn't work, and I've known people after surgeries because I've taken care of many patients with this problem also through my career. So I highly recommend the exercising, traction, massaging, cold packs, even warm packs, but cold packs I think work better. And the cold actually turns into heat after I think it's 5 minutes. And try not to have the cold pack, especially the warm pack, no more than 10 or 15 minutes at a time because you can hurt yourself. So be careful with the warm packs if you're going to keep them for any period of time. And I don't have them more than 10 or 15 minutes, especially the warm pack. And that's about all I can say. It's basically you can heal yourself, you can help heal a friend with the exercising, the traction, the cold packs, and if you need pain medicine, take it. If you have it, just try not to get addicted because it's very addicting. So I take Motrin now. That's the best thing that helps me. If I don't have Motrin, I'll take Tylenol, whatever I have to take. But Motrin, 800 milligrams, that'll last you for about 6 hours. I think 6 to 8 hours is the dose for 800 milligrams of ibuprofen, which is Motrin, the same thing. So that's my advice there on lower back pain. And if you have any other questions, I'll be happy to answer them. And it's free. Okay. Thank you. Bye bye.